The next 5 years, there's going to be rapid change. Our aging population is going to throw up new challenges, and there'll be other groups which will have specific needs which we've got to tackle. So we'll keep on improving our social safety net, enhancing it, keep the present approach, but improve the schemes. And I'd like to talk about two things which we will be doing tonight. One is to do with medical care, and particularly with outpatient treatment, especially for older people. Many Singaporeans worry about medical expenses, especially if you are older or you have an elderly member of your family. The 3M framework, Medisave and so on, works well for inpatient care. But for outpatient treatment, I think we can do better. One group of these elderly are those who need long-term care. They may be bedridden or they may have Alzheimer's. And I talked in a Chinese speech just now of some of the things we are doing to help this group. We'll give more support, expand services, make the services more affordable. Another group is patients who have chronic ailments, maybe high blood cholesterol, maybe high blood pressure, maybe diabetes. And amongst the people who are in their 70s, maybe half will have one chronic ailment or another. And when you have something like this, you will know that you need regular checkups and you need long-term medication. It's not that you take the pill 10 days and the problem is cured. You have these pills, take it for the rest of your life. Every 3 or 6 months, see the doctor. Doctor will examine you, adjust the dosage. 6 months later, see you again. Try and keep well for as long as you can. But the pills can be expensive, particularly over a long period of time. And the low-income patients, sometimes they tell me they may skip an appointment because they fear they can't afford the pills. Or they may say, the doctor says I eat this every day, but I take it every other day instead to save money. Which is not the way it's supposed to be done, because if you do that, your condition will worsen and more trouble will come later on. Serious complications. So I think that we should make outpatient care more affordable and accessible for this group. The elderly and the not so elderly. We have a scheme to help elderly chronic patients like this. It's called a Primary Care Partnership Scheme, PCPS. Helps the low-income elderly and disabled. What it means is you have a card, you're registered, you can see your GP instead of going to the polyclinic, but you get a subsidy like you're going to the polyclinic. So it's more convenient, you have more choices, and you probably get faster service. We will change this scheme, which is now quite restrictive, and you have to be 65 years old before you're considered for this scheme. We will change it so that you can start at the age of 40. Because when you have high blood pressure or cholesterol or diabetes, by the age of 40, it's beginning to show up, particularly if you haven't looked after yourself. And when you have conditions like this, the earlier you start treating, the better I think the results will be. And you have to cooperate, and we will make the scheme to help you to be able to have consistent treatment over a long period of time. And we will also revise the income criteria to include more households, so that a broader range of households can come in under the scheme and can get consistent, good long-term care. We will also make the medication more affordable to lower-income households. We will expand the drug list so that it covers more drugs, and we will increase subsidies for the more expensive drugs with safeguards so that those with chronic ailments or cancer, where chemotherapy can be very expensive, well, you'll get more help. I think these are major moves. We will implement them carefully, and as we gain experience with them, we can consider how to fine-tune and how we can take further steps forward. We have to be very careful because you don't want to end up like the Americans, where the government health schemes have eaten up a huge amount of the budget, and financially and fiscally is a big problem for them. But we can do better, we will do better, and MOH is working on it, and they will announce the details later on.